started. It's a couple minutes after 12, and I want to make sure we're getting all of our good questions answered and we'll get to really experience everything there is for you to share with us today, Dr. Edwards. I think you're one of the most joyful and inspiring people to work with. And I just want to welcome our viewers again and say, please feel free to add questions into the chat box if you have questions for Dr. Edwards or for me. But let's go ahead and get started. So Dr. Edwards is a pediatric oncologist and hematologist, and he is the chair of the National Medical Advisory Council, which advises the board of directors and the leadership of Make-A-Wish America. He's in the Army, went to med school in Philadelphia, is currently stationed at Walter Reed. And let's kick it off. Let me ask you, can I call you Jeremy or should I stay down?
Absolutely.
Okay. All right, Jeremy. So lots of children out there dream of becoming a doctor. Can you tell us how old you were when you first realized it and what drove you to a career in helping others?
Sure. Well, first, I just want to say thank you to everyone who is listening. I want to say thank you to all of the board members, the donors, the employees of Make-A-Wish. It's an absolutely amazing organization, and I've been happy to dedicate a lot of time to it. So I just wanted to start to say that and say, thank you from the bottom of my heart for what you do. And, hopefully the impact that you all make will come out as we tell some stories today. But Leslie, back to your question. So I don't remember not wanting to be a doctor. I've always wanted to be a doctor. The earliest I can remember is watching the show Emergency on TV.
One of my favorites.
Old school show about the two paramedics, a fireman.
Oh yeah.
And I wanted to be the guy who answered the phone at Rampart, which is the name of the hospital. I wanted to be, to be able to be that guy. I didn't want to be John and Roy, the two firemen. I wanted to be the doc at Rampart, and just always loved that. And my parents definitely always got me books on medical detectives and things like that. I loved the show Quincy and wanted to be a medical examiner for a while. Then realized I liked talking to people too much, and so went a different direction. But just have always wanted to do it, just because it's challenging, it's fun, and I just really enjoyed being able to make an impact.
Yeah. It's funny you say that. My husband always talks about how he had an emergency lunchbox, and Quincy was my favorite show growing up. I would tune into that every week. You've given so much to the Army and to pediatric medicine over your career. And I now know you're specializing in palliative care. And I admit that I did not know what that meant until you told me last week. And so I'm going to guess that there are other people on this call that don't know what that means. So could you please educate us a little bit on what does that mean? What kind of children do you treat?
Yeah, absolutely. And Leslie, you shouldn't feel bad that most people don't know what palliative medicine is, or they have a very skewed view of it. Palliative medicine is really a specialty that helps any patient that has a need for an extra level of support, an extra layer of support. And we do that a few different ways. We do that through symptom management. So if patients have symptoms that are really difficult to control, we have some expertise. And then really communication skills. We have extra training, specific training in difficult communications to talk about goals of care and really make sure that our patients and their families, what's important to them and who they are is honored as part of their treatment plan. I describe medicine as a steamroller where once it gets going, it's very hard to turn, and it sometimes rolls over everything in its path to include patients. My job as a palliative medicine doc and as a physician is to really make sure that our patients and our patients' families are in the driver's seat of that steamroller, being guided by the doctors, but not being rolled over. And so as a palliative medicine doctor, I really see anyone who has a complex, difficult diagnosis, having a difficult journey, and really add a layer of support. A lot of times that does end up to be people who have run out of treatment options, who have no further medical treatment options available and may be facing the end of their life or a shortened lifespan. And my job is to help guide them through that, both from a medical symptom standpoint, and then also from a social, emotional, spiritual, existential standpoint as well.
It's very interesting. What other types of specialists then do you bring into the care team?
Well, that's a really important point because what we do is so what we call multidisciplinary or interdisciplinary. One thing I've learned over doing medicine for 20 years is that it's not just about doctors, it's not just about nurses. It's all about patients, and everyone else in the team works for the patient. And so we really bring in some pretty specialized people to help us with palliative medicine. Our teams usually include social workers who are really specifically versed in the different supports, hospice support, different nursing home support, things like that, to be able to really allow patients to have the best quality of life possible. We have specific palliative care nurses who are good at symptom management and psychosocial support. We bring psychologists on board. Child life specialists are incredibly important. And then our nurses are incredibly important, and our other physicians.
That's very interesting. Like I said, I didn't even know that specialty exists, but I can really appreciate how important that is for families in particular who are dealing with this problem that may not go away anytime soon. So turning to Make-A-Wish, tell me, how did you first learn about Make-A-Wish? What was your first experience with our great organization?
So I had heard a little bit about it as I was going through my training, but never really had any specific interactions. My first real interactions were, interesting enough, with the Mid-Atlantic office when I was here as a fellow, because I did my oncology training at Walter Reed, and a lot of our patients qualified for wishes and were eligible. So my first interactions were talking with the team back in 2007, 2008 timeframe to get our patients' wishes. And then when I moved to Hawaii to be a staff oncologist, I was given the opportunity to join the Make-A-Wish board of the local Hawaii chapter there, and was really able to see it from the leadership side, from the board of directors side of the house, and then also able to start making some changes within the medical community there, and then really got involved on a national level when I started attending the national conferences as a board member, and kind of keyed in with a couple other key people who were also board of director members, but were physicians and other pediatric specialists. And then we really saw the need for a kind of a robust advisory council made up of physicians who are really understand and buy into the mission of Make-A-Wish. And that's kind of where we are now.
So as the chair of this organization, now you've served on the council for 3 years, and in the past year, the chair. What does that responsibility entail, and what does it look like for you on a daily, monthly basis, and especially now during COVID? How has that work changed?
Yeah, it's definitely changed over the last few months. So really, my job is to help coordinate and to liaison between the medical affairs office at Make-A-Wish National and the different chapters, and really make sure that we're being consistent, we are being equitable, and we are being flexible with our wish eligibility, and making sure we're keeping our wish kids safe. There's so many things with wishes, and our wish kids by definition have fragile medical illnesses, and we need to make sure that we're able to give them the experience that they are supposed to get with Make-A-Wish, but while keeping them safe. We're not in the business of making kids sicker. And so we're really cognizant of travel safety in particular. That was a big part of my job initially, was making sure that we had good travel safety guidelines to allow the chapters to be able to take care of the kids to the best of their abilities. So a lot of what I do is liaison with the medical affairs and then national leadership and the board to really make sure that they're understanding the medical side of the house, and all of the big, great things that they wish for, or that they come up with, are things that we can put into practice safely, and have some science behind them, and really make sure that we're being objective and safe.
Yeah, I'll tell you, it's in addition to the National Medical Advisory Council, we have our own group of doctors here in the Mid-Atlantic. You also serve on our chapter's advisory panel with a dozen other people from all different specialties and all different hospitals. And from a staff perspective, being able to call you when we have questions to make sure we're delivering wishes that are appropriate for the child and that, especially now, are safe. It's a really valuable resource for us. I think a lot of people think that because of COVID and all of our kids want to go to Disney, we're not granting wishes now. And that couldn't be farther from the truth. We're just granting wishes differently and granting different types of wishes. And that's all thanks to the guidance that we've received from the medical advisory panel. So I personally thank you for that. It's been, I don't think any of us could have realized how this would have unfolded, and we still don't know how it's going to end or when it's going to end. And the flexibility and the expert medical guidance of you and your colleagues on the panel is enabling us to grant wishes to kids now, despite the global health pandemic. So I thank you for that. So you're often the person that tells a child that they have a diagnosis of a critical illness. And I can't imagine how you do that day in and day out and how trying that must be for you. But on the flip side, you also get to be the person that tells a child that they're eligible for the wish. So what's it like to experience that, and how has it impacted you personally to have that responsibility?
That's a great question. And I always tell people, if you ever want someone to really buy into to make a wish, and you want them to really understand what they do, all they have to do is interact with the wish child wants, with anything to do with their wish, and then that's it. They're hooked, because going from some of the worst days of my career, having to tell people some of the worst news they could ever imagine to hear, and then being able to tell a child that they get to wish for something. And then we're going to do our best to make that wish come true and grant their one true wish. And then see their face change. And then not just their face, but their whole demeanor. And then see their mind just start to go to those places of, well, what do I want to wish for? I could wish for this. Can I do this? And then it changes everything. And all their future visits usually have something to do with that. So they're coming in again for another dose of chemotherapy or another procedure. All you have to do sometimes is say, hey, did you think more about your wish? And then boom, they're there. They're in a different place and they're distracted and they're not thinking about being sick or not feeling good. They're thinking about that wish. They're thinking very literally about that hope and joy that it's giving them. And we use that. I mean, within our medical, where we use this as a treatment to be able to help care for our patients, because I'm not just caring for them as a patient with leukemia or a patient with cancer. It's a little boy, it's a little girl, it's a family. And so using the wish as part of our treatment course, as part of a way to get them to be able to take their medicine more consistently, to be able to, get them to focus on something else and be in better spirits and be stronger and maybe eat a little more so they'll be stronger and be able to tolerate their medicine better, is incredibly humbling to be able to see, but also incredibly rewarding, and allows you to do things that are sometimes very unpleasant for these kids to do. It gives you that, as the provider, as a clinician, that hope and joy as well. So very really affects our ability to care for our patients, as well as our ability for patients to accept our treatments.
Yeah. Well, I know when my son was diagnosed, we had the news completely came out of the blue. Our lives changed instantaneously. And then the day later, our oncologist told us that he qualified for a wish. And I had the notion that I think a lot of people have, that misconception that wishes are only for children with terminal illnesses. But now there seems to be some studies and a growing body of evidence talking really about potential medical impacts of the wish. Is that something, have you experienced that in any of the children you've treated, or is there comments that you could make on, from a physician's view, how a wish really can transform a child during treatment?
Yeah, absolutely. I've never looked at it as some of my colleagues have from a research standpoint, but I have a lot of anecdotal evidence. I've definitely seen from personal evidence where kids are more likely to come in, they're more likely to not fight treatments, they're more likely to be compliant with their medicines, as you can use kind of a wish to distract and give them a goal. say, look, we're getting you through this so we can get you to that wish. Which is why I like to bring up wishes early in the illness process. I know I have some colleagues and people say, well, we usually like to bring it up later. I really like to bring it up because the whole purpose to me of the wish is to give them that spark of hope and joy. And I like them to be able to focus on that as they are going through some of the harder parts of treatment, so that we can talk about it and we can come up with it. And I get to hear their crazy wishes that they want, and we get to, make them crazier and really make your guys' job even harder trying to.
Thank you for that.
You're welcome. But we definitely have some initial research out there, and there's a couple different big studies that, one from a qualitative standpoint that shows that quality of life improves for kids. The Israel Wish study, that quality of life improved for children, pre and post Wish. And then there was a study out of Cincinnati that really showed that healthcare utilization went down after a kid was given a wish, when they were compared to other children of the same illnesses who didn't have a wish at that point. So they're both small studies, but they are really showing us that something that we've always known is that a wish can be a vital part of a treatment, and really has a role to help us. We'd love to see kind of more of these studies and more of these experiences. But again, these are things that are really just, to me, confirming what everyone who's been a part of Make-A-Wish already knows and keep in their heart.
Yeah, we do here at our chapter. I'm not sure if all the chapters across Make-A-Wish America do it, but we do a post-wish survey with all of our families, and the responses in terms of expectations being met and being able to really see a change in your child. If I was a company, I would love our scores, our net promoter scores. We're always in the 93, 95, 97% of very satisfied rankings when we get these surveys back. And as I think I've told you in the past, my son's wish was a travel wish, but he had to have a stem cell transplant. So we waited 2 years from the time we decided on our wish to the time we actually went. And it was during those months of isolation, lockdown in our stem cell treatment ward, where we would spend hours on end looking at photos of where we were going, talking about what we were going to do when we would get there. And we still talk about it today as kind of the capstone for us. It was at the end of treatment, a real celebration, but it gave us that kind of steam we needed to get through some of the most challenging and darkened days. So I think that whole social, emotional impact of a wish, a lot of people say their wishes are just something nice we should do because of the warm and fuzzies. But, I think you and I both agree that they're necessary for these kids and their siblings and their families as well. I also want to invite people again to type in your questions for Dr. Edwards. I hope you're all enjoying our conversation. And I want to ask you about some of your favorite wish stories. Are there any children and wishes you just said that you make them crazier? That's something you like to do for us. Are there any wish stories that stand out to you?
So I've got and the ones I really love are some of the ones where the kids really had no idea that they would be eligible, and maybe they have a chronic illness or they've had something they've been dealing with for a while, and the medical team has appropriately been just really focused on taking care of the patient. And sometimes it does take someone to come in and say, hey, have you thought about a wish, if maybe they didn't have quite as much of the education or the exposure that I have. So I had the opportunity recently, right after I got here to Walter Reed, to have a patient who I was seeing for some complex pain issues. And no one had really thought about her being able to get a wish because she had her diagnosis for quite a while, but she really met our criteria. And so I was able to come in and say, hey, has anyone thought about telling this patient she may be eligible for a wish? And I always want to talk with the team and before I tell a patient, just to make sure that we're on the same page. And, I had to do a little education and say, here's why she would be eligible. And they had asked, are you sure? And I said, well, since I helped write that guideline, yes, I'm pretty sure. And when there's a question, it comes to me as the final authority. So I'm pretty sure she's going to qualify. And then, you know, they were able to say, okay, that's great. And oh, we have some other people we could think about too. But then I said, would you mind if I go in and talk with her about this wish? Because knowing I was helping take care of her for chronic pain control, I was able to go in and say, you know, here's the things A, B, and C I want to do for pain, but let me tell you about something else that may be a little bit unorthodox for your treatment. And I told her about Make-A-Wish, and almost immediately her face changed, just absolutely changed. And I hadn't given her any medicine. I hadn't done anything like that, but I could just see her change. And all of a sudden she's like, well, I want to be a marine biologist. Like, okay, so what do you want to do? When I go to an aquarium, I said, okay, no, aquariums are really cool. There's a fantastic one here. Have you been to it? She's like, oh yeah, I've been to the Baltimore Aquarium. I said, okay, so let's think bigger. You know, what does that mean? Do you want to meet a marine biologist? What do you want to do? And so she, you know, started talking about it. She's like, well, I don't know where I would want to go. I'm like, well, you know, Florida, there's University of Hawaii, where I had been, has fantastic marine biology program. You know, there's, you know, think like that. But if you want to be a marine biologist, say, I wish to be a marine biologist. And then guess what? The incredible wish granters and the wish teams will come up with something that will blow your mind. And then I got to see her in follow-up. And every single time she's like, oh, and I thought about this. Oh, and we're going to do this. And oh, guess what? I met with my wish granters and we're going to do this. And oh, they put me in touch with this person. And I've already had a teleconference with this person every single visit. And we stopped talking about her thing, and we talked about her wish first thing. She hasn't had that wish. It was put on hold so far, but she's still talking about it, and she understands that it will be able to happen. And she's still gaining that spark from it, and that's what's absolutely amazing.
That's great. And in your own words, when you think about what a wish can do for a child or for a family, can you put into words the power of a wish? People always ask me that, and I struggle with it. So I'm wondering if you as a doctor can come up with anything that I could steal.
I don't know if anyone can truly put the power of a wish into words. I know a lot of really smart people at the chapters and at National have tried to. And I don't know if I've ever come up with it, but the biggest thing I can think of is game changing. I mean, to me, a wish for a kid with a chronic malignant degenerative disease that's life-threatening is a game changer. It absolutely changes the face of their illness, changes the face of their experience. And so I really can't say more than wishes are necessary, and wishes are game changing for these patients. And sometimes there's so little we can do to help. And most of the things that we do, in fact, are very unpleasant. Being able to give something like this is absolutely a life-altering thing, a game-changing thing. And I have to say that extends to the treatment teams as well. Being able to be a part of those and seeing those wish books when they come back and hearing about it is an absolute game changer for the treatment teams too.
Yeah. I think that's interesting. I don't think we, at least, I've never stopped and thought about it from what a wish means from the perspective of the person caring for the patient, or the volunteer who makes that wish come true. You know, I have my staff hat and I have my Make-A-Wish mom hat on, but there is that whole other kind of community, medical community component to it. The other part of the secret recipe to a wish are people in your positions. Are there any kind of, have you ever had a memory or a child or a family share something with you that's stuck with you and maybe changed your life or changed your perspective on things?
I think a lot of the experiences that I've had, even without kind of talking about wishes, just the experience of seeing kids go through some of the absolutely just really honestly horrendous things that they have to go through, and seeing that the attitude that they have. I actually had an experience yesterday seeing an adult patient for palliative medicine who had a lot of different chronic illnesses and has been, unfortunately had some amputations done and is having a really hard time with those. But she was telling me about a small girl who had an amputation for another reason, who she was watching at physical therapy. And she was watching just run around on her prosthetic legs and just be having fun and just laughing and having joy. And kids who are ill teach us that you can still have joy, and teach me that doesn't matter how bad things can be, you can still have perspective and have joy and have happiness. And that's the biggest thing I've learned through my patients, both in general pediatrics, pediatric oncology, and pediatric palliative medicine, is that there's always still joy to be found. And the reason I think Make-A-Wish resonates with me so well is that it's a concrete way to find that joy. The new PSA that Make-A-Wish has of that group of kids in the family pulling that star and letting that star shine through the lights, shine through the window of that child's bedroom. It's just such a great metaphorical thing of exactly what we're doing. There's always that joy, and kids will find it. So I love that it's a kid pulling that rope for the first time, because kids find that joy. And what they can teach us is that it's always there. We just sometimes have to look for it. Make-A-Wish is just a fantastic, concrete way to find it.
So we did get a couple of questions in. One, which is, what was the most outrageous wish a kid has brought to you?
Ooh, so my favorite wish of all time is, this is a wish of Carl, who was from, I think he was the Washington chapter, and he wanted to be, this is when I was in Hawaii, so it's perfect. He wanted to be a World War II pilot who was shot down over Pearl Harbor and had to survive on a desert island. That was it. That was his wish. He was a huge history buff and read all about it. And they came to me, and the chapter said, I need your help. You're military, help us. And so we got to design this kid's experience. He went to survival training. We spent the night on the USS. We got him a flight in the Stearman biplane, which was the training plane for World War II, which had a then crash landing. And then we kidnapped him with a whole platoon of Marines, and we stranded him, again, quote unquote, stranded on a deserted beach in Hawaii with a whole bunch of cans and old can opener and an old parachute to cut up and to be able to survive.
Oh my gosh. We
had a group of Navy combat divers storm the beach out and then, catch some fish and light a fire. And so that was one of the most fun. And I got to take part. We met him in character. I went and I got an old school kind of khaki uniform. We met him, we enlisted him in the military as a first lieutenant pilot. We enlisted his dad as a private so that he could order his dad around.
Wow.
Got to do the whole thing in character. We had old school military vehicles. It was a lot of fun. That is
so cool.
It was so cool.
This is for anybody watching, this is my wish kid. This is my son, Jack, who's just popping down from doing hopefully online schoolwork, but maybe Minecraft. I don't know. But Jack's wish was to, do you want to tell people what your wish was? Yeah. Well, yeah, that did sound like a cool wish. Speak up. No? Yeah.
Okay, so my wish was to go to the Maldives, which is a like exotic island. Yeah, so that was really fun.
Yeah.
Very
also,
cool.
Budding marine biologist who wanted to see the bioluminescent sea. So that was kind of the notion behind that. So I also got a comment here from somebody who is a Wish family. I don't know who it was, but they wrote in and asked us to share just this little story that says, our wish was absolutely the greatest experience of my son's life. It was magical for our whole family. We're forever grateful. And it still brings all of us so much joy. Thank you for making life a little more bearable for kids like mine. So thank you, Dr. Edwards, and the medical community for that. And we're coming up on our half-hour mark here, and I know people need to get back to their work from home desks. So I wanted to just ask you what I think is the hardest question that I'm ever asked, and it'll be the hardest question of all the things we've talked about today, and that is, if you were given a wish, what would you choose?
That is I've been asked that one before, so I've had to give it a lot of thought. So I always have to say, if I could have an all-access pass to the Summer Olympics, single sport I wanted, anywhere I wanted, the whole thing, that to me would be absolutely amazing. If I was apparently a better person, I would say world peace or, you know, something like that. But if I'm going to be realistic, I want to go see the Olympics. That would probably be my absolute dream, because I'm a huge Olympics fan. I love that. I'm stuck in front of the TV and my computer all 16 days.
Any particular sport?
So I was a swimmer in college, so I love Olympic swimming, and I love cycling. My family's a big group of cyclists, so I'd love to see all those events. Track and field's always a big one. It's really absolutely anything I could get my hands on would be fantastic.
Yeah, it's too bad. We had quite a number of children across the country scheduled to go to Tokyo this year. So hopefully they'll be able to travel next year when the games are rescheduled. But Olympics and big sport events like the Super Bowl and World Cup are always things that a lot of children across the country wish for, including children here in our own chapter territory. So
absolutely. And if you need a medical chaperone, I am available.
Yes, I'll carry bags anywhere. I'm fine with that. I'll be a food taster, whatever you need. Sherpa could be my other part of my title. But I want to thank you for joining us today. It's always good for me to hear from you and to be inspired by you. And I want to thank everybody who tuned in today and who will watch this recording later. I know there are a lot of people on this call that are Wish families, but also our Wish granting volunteers with whom we could not make wishes possible. They're really our arms and legs out there in the community, interacting with our families. And then, of course, our volunteer board members and donors, the financial support received from the community. We couldn't do what we do without everybody in the Make-A-Wish family. So thank you. Go back to your day job, make wishes come true, and hopefully we'll see everybody again soon for another one of these opportunities.
Thank you, everyone. Thank you, Leslie.